Hey there, guys. So I want to thank you for joining today's live stream. And I want to thank you, of course, for taking the time to bear with me this week. Of course, I know everybody's kind of been off schedule, but I still wanted to do the live stream because I did build out a live stream for this week, even though I knew that I wasn't going to be doing one on my normal day on Wednesday. But I do want to share this topic because I think it's an important topic and it's a very unique topic that I've not really discussed. Um, so I hope you find this helpful. And I know this topic is more geared towards somebody who may have some of these particular conditions that I'm going to talk about today. However, I think it's still very informative for anybody in any situation. And it's sort of something to be aware of and to know how to adapt to these specific situations. So before I get started, I do want to sort of mention my website, which is bponlinefitness.com. I will have the link to that at the end of this live stream to where you can put in that address. So check that out at the end. So I did want to mention that. And I will likely have another promotion coming up for New Year's. I don't have that out yet, but I am working on adding a promotion for a discount for New Year's. So watch out for that. If you're not already in my online fitness program, definitely check that out. So let's go ahead and get started with talking about today's topic, and that's going to be adapting fitness to chronic conditions. So one thing I do want to mention before I do dive deep into this particular topic is that this specific live stream is just for informative purposes only. So don't take the advice that I give you today as any kind of treatment. What I'm going to be giving you is informative. So if you do have any of the conditions, health conditions that I discussed today, make sure that you do talk to a healthcare professional and don't, use what I, have given you because this is only for the purposes of you to be aware of in a preventative measure in a sense. So just keep that in mind that that is what this particular live stream is for. So again, just treat it as something to be aware of, but don't treat it as something that's, to be used as a treatment. So the different topics that I'm going to discuss today are mainly four distinct topics, and that's going to be personalizing workouts for different conditions, recovery and chronic conditions, mindset and motivation, and staying active despite challenges, and adaptive equipment and tools. So these are the four key points that I'm going to go over today in this particular topic. So let's go ahead and get started. And I'm going to touch on a few different conditions. I can't, of course, go over all of them, but I'm going to go over some of the most common conditions that are out there, and we're going to go from there. So, arthritis is the first one. So, your main goal is if you're somebody keep in mind that when we're talking about these topics, each specific condition, I'm going to sort of go through the specific goals that you should focus on if you do have that particular condition to sort of understand what we're talking about. So, for anybody who has arthritis, your main goal should be to improve joint mobility, reduce pain, and increase strength. So, some of the recommended exercises that you should keep in mind is swimming, walking, and cycling. Of course, you do want to focus on gradually, increasing strength, much like I talk about with other workouts, for somebody who has particular goals with, even if it's like muscle gain, you still, in the same vein, like with anything, you want to focus on the gradual progression. So when you're doing strength training and you're somebody who has arthritis, resistance bands are a great option. Light dumbbells can be a really great option. Of course, focus on low weights and high reps. I've mentioned progressive overload multiple times, but one thing I do want to mention that a lot of people aren't aware of when we're talking about the topic of progressive overload, many people oftentimes associate increasing intensity with just increasing weight. When you can increase intensity in various ways, that could be increasing reps. So if you cannot lift, particularly heavy weights, You can focus on increasing your rep range rather than just increasing the weight. If you just have that limitation, that's a great way to include progressive overload. That's, basically a way to sort of supplement without, having to strain yourself with lifting a heavier weight. So that's still a form of progressive overload. Another thing you could do, um, again, if you're somebody who is in this condition as well, is you could shorten your rest times to increase that intensity a little bit. Of course, at the same time, you don't want to overexert yourself. So keep that in mind. But if you're somebody who still, sort of slightly wants to increase that intensity and you're not comfortable with going up with the weight, you can do that with, just focusing on the low weights and then the higher reps. So range of motion movements is another thing that you can focus on. General gentle yoga or tai chi, as well as stretching, anything like that. Again, it's very light movements. You want low impact based exercises for, anything related to this particular condition. So with somebody who deals with diabetes, here's the goals that you primarily need to focus on. So, of course, you're wanting to improve blood sugar control, enhancing cardiovascular health, and managing weight. So, that should be your general goals that you're going to focus on. And keep in mind that you may have other goals outside of just these specific goals, even if you do have that condition, which is totally fine. So, some of the recommended exercises to keep in mind for this is to do cardio, brisk walking, cycling, or rowing. Aim for 150 minutes of cardio per week. Again, you can disperse that throughout, each day of the week. It's not like you have to do, a total, hour or so. It's all about dispersing that throughout the week. So for strength training, weightlifting or body weight exercises can be beneficial. This can be 2 to 3 times per week. You can start with that. Again, it's sort of the same situation when we're talking about progressive overload in this sense as well. But again, your main focus should be, the basics and focusing on really building that habit. And that is body weight or weightlifting, light weightlifting, of course, to start out, and 2 to 3 times per week. HIIT training can also be a good option. And basically, what HIIT training is, of course, I mentioned it before, but HIIT training is high intensity interval training. So this is short bursts of high intensity exercises followed by rest periods. Um, this can be a very intense form of training. I've done this type of training before. So keep in mind that this may not be for everybody. And you should, sort of go at your own pace if you're wanting to try to do any kind of interval training. So keep that in mind if you're wanting to try that. However, you can get a really good workout when it comes to high intensity interval training, but just focus on again, it's short bursts of high intensity and then have optimal rest periods. Allow yourself, enough rest between those intervals so that you're able to go through, and not be completely exhausted through the workout. So that's something that you need to keep in mind there as well. So for somebody who has COPD, which is cardio obstructive pulmonary disease, again, guys, I do want to reiterate that this is only for informative purposes. So again, if you do have any of these conditions, don't, use these as treatment, but use these as, just general advice. So the key goals that you should focus on, of course, is improving breathing efficiency and maintaining overall strength. Breathing exercises can be a good option. So this is diaphragmatic breathing and pursed lip breathing to enhance oxygen flow. There's different breathing exercises that you can try that can help. This is something that could also be sort of implemented into an exercise routine, like when you're going into maybe a cool down. That could be a great option to add into your cool down for exercises. Low impact aerobics, of course, walking, stationary bike at a pace that doesn't overtax breathing. Again, the main focus should be, being in a comfortable, sort of rhythm to where you're not overexerting yourself, and that's the main focus here. Strength training, focus on upper body to assist respiratory muscles. Again, focus on light weights. If you're wanting to do body weights, don't, do a lot of intensity. But the main focus should be, maintaining your breathing. Another thing too is proper breathing as well in your exercises. If you're doing an exercise normally when you're going through the movement, you want to focus on sort of inhaling as you're lifting the weight and then exhaling as you're, lowering the weight. So in your eccentric phase, you want to make sure that, you're inhaling, and then as you are lowering the rate back down in the concentric phase, you want to make sure that you're exhaling. So proper breathing does is extremely important, and it's not only important for somebody who has this condition, but also for somebody who has other goals as well. But in particular for this, proper breathing can be very beneficial for this type of condition. So recovery in chronic conditions. So of course you need to be aware of, the condition that you're dealing with, understanding that condition and your options. Of course, you do want to have a support network, family, friends, and community that are going to help you with this. You do want to make sure that you're making lifestyle changes. So making sure that you are keeping a track of your nutrition, your exercises, sort of managing your stress when dealing with these conditions, and adhering to treatment plans, whatever maybe your healthcare professional is giving you, your doctor. Focus on what they give you as priority, and then make changes to your routine as you can, as you're capable of making those changes. um, and just like anything else, even if you're somebody who is focusing on any particular goal, it's very important to just be patient. If you do have these conditions, it may take longer for you to sort of see changes in how you feel and see changes in, just your daily routine. So just be patient with that and understand sort of these different things to keep in mind. And just, make sure that you are going at your own pace. Don't try to rush, and don't try to, you know, even though you do have particular goals that you do want to reach, always be patient and just take it step by step and day by day. And just, again, be aware of your condition, have a good support system, make those gradual lifestyle changes. It's not about, completely upending, everything in your life. It's about picking pieces that you can easily change, habits, maybe bad habits that you have, and slightly changing those habits so that you can build healthier habits. That's the main focus. And that's one thing that a lot of people really struggle with is whenever they start something new and they want to, you know, achieve a specific goal, they just want to up in everything, and they just want to completely start from scratch, like just jumping into a routine without having a plan. You can't do that. That's, not only for this goal, but goals in general, but you want to make sure that you're building something that's sustainable, focusing on small habits like with your nutrition, making minor changes to what you eat. You don't have to completely get rid of what you would normally eat in a day. You just need to gradually make those changes. That's the same way with exercise. You don't have to do a whole, hour of exercise getting started. Even just a few minutes, like 15, 20 minutes, 30 minutes to start out is completely fine. It's just about, the gradual changes that you're making to build that sustainable habit, and that's what matters most. So, some signs of effective recovery. This is basically the signs you're going to know if you are somebody who has the specific conditions that I mentioned, and you have been staying with your routine, you've been consistent with it. You will likely notice some of these improvements with how you feel. So, reduced flare ups, improved ability to perform daily tasks, enhanced emotional resilience, which is, of course, being stronger mentally, in other words, enhance mood and reduce feelings of stress or anxiety, greater ability to cope with challenges, and improve self-confidence and a sense of independence. So you're going to notice changes. Again, it's a gradual process, like with anything when it comes to, building a fitness routine, not only for these conditions, but any kind of condition that you, again, stay patient with yourself, focus on the basics, focus on the small steps. You don't need to make the big leaps. It's all about the small steps that you take in order to reach that goal. So, mindset and motivation and staying active despite challenges. So, this is sort of going over basically sort of the mental aspects of things and how to overcome those, even if you do have limitations. So, when it comes to, mindset and motivation, one thing I do want to mention before I go over these points is that many people oftentimes associate, fitness with motivation and that you have to be motivated to exercise, but that's shouldn't be the case. Your main focus that you should make priority when it comes to exercise is focus on discipline. You are not going to want to exercise every day, especially if you're somebody who has these limitations. It's going to be hard to overcome, that sort of challenge, but you're going to have to build the mindset. Anybody can build a strong mindset, no matter where they're, whatever condition they have. It's all about, being able to overcome that mindset. So focus primarily on discipline and not your motivation, because you're not going to be motivated every day to exercise. So keep in mind that your thoughts are going to shape your actions. Always focus on, thinking positively and focusing on, again, the small steps. Create small, goals that you can achieve. Um, Even if it's gradual, really incremental goals, focus on those. Um, Again, just showing up to the gym, at least attempting and, trying to get, a routine going is really an accomplishment in itself. A growth mindset helps you focus on possibilities, not limitations. Always focus on what you're capable of doing. Again, be patient, and just really think of the process more than the outcome. Staying active isn't about perfection, it's about progress. Again, gradual progression is the main goal. If you just jump into a routine and don't have a plan, you aren't going to stay with it. Set small, achievable goals, focus on consistency over intensity. Keep in mind that even if you feel like in your routine that you've not been able to go up in weight or you've not been able to increase your intensity in any way, that's okay. It still takes time to build strength, especially if you have these limitations. It's going to take a tad longer, so really focus on just showing up and continue to learn, you know in your routine as you're showing up. Celebrate every win. Acknowledge progress no matter how small it is. Again, like I just discussed, small progression is important. These small tasks and these small steps that you take matter more than anything else because they are what's going to get you to your outcome. It's all about the trip and not the destination. So keep that in mind. Stay flexible. Modify your workouts to fit how you feel each day. If you feel really sluggish one day, or if you feel like you've not slept well the night before, lower your intensity a little bit. And then in the next workout, increase it. Um, Again, just, sort of modify it to fit your certain situation. You still want to challenge yourself, of course. You still want to show up and do, what you're uncomfortable with, because that's the main goal. We do want to be uncomfortable, but we do want to stay flexible and modify that as we see fit. You don't want to overexert yourself or exhaust yourself so much. But modify those workouts as you need them. And then, in the next workout session that you do, challenge yourself from there. You also want to track your progress. This is a very important thing that a lot of people do not realize. And I see this a lot of times that a lot of people don't do this. And this is something that, whenever I got started with my routine, I failed to do. I didn't understand the importance of tracking progress, but it makes a difference. And especially if you're somebody who is dealing with a chronic condition, this can help a lot because it's very important to see, you know, again, the small changes that you're making, with your fitness routine. So you can use journals, you can use apps, um, anything that can, keep you focused and inspired. Use those. I track my nutrition, I track my workouts. I use different things to do those. With my nutrition, I usually do it through MyFitnessPal, which is an app where you can, log your nutrition and you can do pretty much all of that for free. And then I use my notes app on my phone for tracking my workouts. Really simple. All I do is, put my sets and reps that I did that day, what specific workout I did, and I sort of graph it. I put it in a graph to where I can separate it and I can see, clearly understand, what I did each day. And then I can go back and I can scroll up and I can look in my whole, the note that I've made and I can see what I did over the previous weeks. So whatever works for you, you can do this as like a pen and paper. But a lot of times there's people that wonder why they're not making progress in their routine. And a lot of times it has to do with not tracking your progress. And again, it goes back to goal setting as well. That makes a big difference. So again, it's all about your discipline. It's all about, being flexible and about, tracking that progress. Tracking progress is extremely important. It took me a while before, I became a trainer to sort of understand how important it was. Nutrition was one thing that I did not understand for the longest time, but it makes a difference because you're aware of your intake. You're aware of, any kind of nutrient that you're getting. With MyFitnessPal, it breaks down pretty much everything that you're consuming. You can go in there and search whatever you've, consumed that day, whatever kind of food you've ate and it'll break down how far you are from your goal. You can set how many calories you want to consume in a day, and it breaks down every specific nutrient based on that food that you've logged, and it just gives you a good idea on what you're consuming each day. But again, you do want to sort of set reminders for yourself to sort of stay on track with that. That's going to help. um, and that's what I usually do. Usually it'll set me a reminder if I'm not tracked after a specific time. It'll say you missed tracking your breakfast or your lunch or your dinner. Um, the same goes for water intake. That's another thing I track, and that's not something that you necessarily have to, but it's beneficial as well. It goes in line with your nutrition, and there's a lot of benefits that come with, being properly hydrated as well. But the main focus should be on being patient with yourself and really just focusing on the small steps to, reaching that goal and overcoming those challenges. So I did want to mention what Wayne said here on the comments. He said, while mindset is important, I completely agree that discipline is the key. Showing up in the face of any adversity is always better than throwing in the towel. And that's exactly right. Mindset is a challenging thing, and it's just something that you have to work on. You have to really just, you know, when one of the things that I learned, like when I got into like a plateau, one thing that I used to change with my perspective when it came to mindset is that you have to really see it as, like if I show up I'm going to see some form of results. It may not be as fast as I want it, but if I give up, I'm never going to see those results. And that's sort of the way that I like to frame things. Like if I have times where I feel like I'm not making progress and I just want to give up, but the fact is, if I give up, it's not going to show. The results aren't going to show no matter what. But if I do try in some form, those results will show. And that's the way that I like to, sort of see mindset. And especially when you reach a plateau and you feel like you're not progressing, that's the way you have to see it is, you know, just keep going. You know, you're going to see results if you keep going. It's when you give up that those results will not come. So that is definitely true, Wayne. So I appreciate you for sharing that. So, the last major point I do want to talk about today is adaptive equipment and tools that you can use. Again, when we're talking about chronic conditions. So, these are very beneficial and they're all really, sort of low intensity type of equipment. And they're very flexible with using, you can use these types of equipment with various exercises. The first one is resistance bands. This is gentle on the joints and is customizable with resistance levels. Resistance band exercises, there are a ton. There are many different resistance band exercises that you can do. Again, that's going to be gentle on the joints and they are really, inexpensive. You can pick up resistance bands very cheap and you can get ones that are weighted that add some form of resistance outside of just, the normal bands. So they're very flexible and there's a ton of workouts that you can do with them. Stability balls improve core strength and balance. These two are a great option. Balance is something I've discussed before, and I think it's very important to train, because it does help with being able to perform other workouts. That's where, core strength sort of plays a role as well. So the more that you focus on, improving that core strength and balance, it's going to help with performing other workouts. However, there are many different exercises you can do with the stability ball. I mean, there's just a ton of different variations. It's the same with resistance bands. It's all about, what specific workout splits you're going to do that week or whatever, whatever you really want to focus on. If you're wanting to focus on, building, maybe, strengthen the core more, you can do, stability ball crunches, you can do some maybe a stability ball plank. There's so many different variations when it comes to stability balls. Foam rollers, it helps to aid in muscle recovery and flexibility. So foam roller is not something that's necessarily, for exercise itself. It's more of a recovery sort of type of equipment. So this is something that you usually use in a cool down, and this is to help, of course, with aiding in flexibility and with aiding in the muscle recovery process after your workouts. So that's the main point of foam rollers. So chair-based support, so this is ideal for seated workouts such as yoga or strength training. There's different exercises that you can do when you're using, you could use a platform or you could use a chair. There's so many different variations you can do with these. If you have sort of limited mobility, like if you, and again, we're talking about these chronic conditions. If you have that limited mobility, there's exercises that you can do without, having to stand up or, move around as much. Um, so I did want to sort of address what Wayne said here. It says, do you also recommend dip belts, squat belts, and slingshots for bench press? So for somebody who is focusing on when it comes to a chronic condition, in that aspect, I wouldn't necessarily recommend that as much if you're somebody who is, has a specific condition like what I've discussed. However, of course, if you're somebody who, is has pretty decent strength and you're somebody who is, built a pretty sustainable routine and you've been pretty consistent with your routine, I think that's fine to try out. But again, it's best, of course, to focus on light weight if you're wanting to implement that. I don't think it's a bad idea because it helps to add resistance to, you know, those specific exercises. And it brings more of a, a challenge to balance and stability at the same time with that type of, adding those belts. So just keep that in mind that if you're somebody who is, has those conditions, that I would be cautious, before doing that. But I think it can be beneficial in a lot of different situations. So another point I do want to mention here is adjustable weights. So you can find the various different dumbbells that I know you can purchase ones that can be automatically adjustable and you don't have to buy individual weights. There's those options as well. Or again, you can focus on just the individual dumbbells, which are, focusing on light weights, of course. Hand grips and wraps can be a good option to enhance grip. If you're somebody who deals with arthritis, this is going to be a great option. Or any kind of weakness that you may have with, being able to grip, any kind of weights, that can be a great option. So just keep all of these in mind. These are all beneficial in various ways. Um, but again, you want to focus on, what you're capable of doing with any of these types of equipments and tools. So I did say that was my last point, and I thought it was, but we'll talk about this next point here. And this is primarily for flexibility and recovery aids. So I did just mention foam rollers, but there's a few other things I do want to mention here when it comes to the recovery aspect of things. So yoga straps assist with deeper stretches for improved flexibility. And these are, you can find these are, they're another name for them, I believe, is super bands. But you can use these for different types of stretches. Again, when you're focusing on these types of equipments, this is all just to help with aiding in recovery and your post-workout sort of exercises. Foam rollers, self-myofascial release to reduce muscle tightness, stretching mats to provide support and comfort during flexibility routines. Balance trainers such as Bosu balls to improve dynamic stretching and core stability. Bosu balls can be used in many different ways as well, just like with a stability ball and a resistance band or resistance bands themselves. But these are all primarily focused on, with the flexibility and recovery aspect of things. Alrighty, so thank you guys for taking the time to watch this live stream. I hope that you found it helpful and valuable as always. And again, keep in mind that this is only for informative purposes. If you do have any issues, you do want to, contact a healthcare professional. So just keep that in mind. If you have any questions about anything I discussed today, feel free to reach out. I have my website here where you can check out a ton of different information as it relates to online coaching, fitness, and nutrition. There's a ton of different things there, and I usually upload the live streams that I do each week on my website as well on the homepage. And I will have this live stream, of course, uploaded to YouTube. So any other archive live streams are there as well. So if you missed any of the other ones, you can check those out as well. But if you have any questions, feel free to reach out to me by, my phone or email. You can also send me a message here on Facebook. But thank you guys once again. Again, I hope that this was helpful to you. I hope it gave you a little bit of insight. And feel free to reach out if you have any questions. I do have a live stream coming up next Wednesday at 12 p.m. Central Standard Time, which I'll have posted pretty soon. And in this live stream, I'm going to go over fitness trends. Um, I feel like this is a pretty optimal topic to talk about when it comes to the new year. So that's what I'm going to be discussing in the next one. And I'll have that event uploaded pretty soon. So thank you guys once again, and I will see you guys next time.